Illnesses like strep throat can be scary, especially when your child comes down with something. But when they're treated early, it rarely causes a major problem. In this week's First with Kids, Dr. Lewis First helps us spot the signs.
Parents have been asking me some painful questions about strep throats and why we need to treat them with antibiotics. Well, I don't want this condition to be sorely missed by anyone, so here's some information on it. Strep throat, though unusual to see in children less than 2 years of age, is one of the most common childhood illnesses, and when recognized and treated early, rarely causes a problem. However, when missed, strep throat can cause a type of life-threatening shock, result in kidney disease, or progress to something several weeks after the sore throat that we call rheumatic fever, a serious form of heart disease that can also affect the joints, skin, and even the neurologic system. Preventing these complications is why we treat all cases of strep throat with antibiotics. So, when does a sore throat need medical attention, since many are caused by viruses that just get better with tincture of time? Well, a sore throat caused by a virus usually occurs in association with other viral symptoms like a runny nose, cough, hoarseness, red or runny eyes, and/or diarrhea. Strep throat, on the other hand, usually may just involve the throat, which will look red with white patches in the back, swollen glands on the sides of the neck, and enlarged tonsils also covered with white patches. There may also be fever, headache, rash, and some belly pain. If you have any suspicion that your child's sore throat might be due to the strep bacteria, please have your child's throat tested for strep, and if the test is positive, begin treatment with an antibiotic, usually a type of penicillin. Your child with strep is contagious until after 24 hours of antibiotic treatment and no fever for at least 12 hours. So keep that in mind when it comes to deciding whether to take your child to their healthcare professional or send them back to school. A full course of antibiotics is still required for 10 days, even if your child is no longer contagious with strep, to ensure its elimination. Can strep throat be prevented? Well, there's no vaccine, and even if you have it once, you can get it again. But you can reduce the chances of your child being infected by having children not share their food, drinks, or towels with other family or friends, and to sneeze or cough into their elbow and not their hands. Hand washing is, of course, a great way to minimize the spread of this bacteria, so that hopefully tips like these will be easy ones to swallow when it comes to knowing the importance of recognizing and then treating a strep throat. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.